Welcome to Plastic Surgery T&A. Talk and advice with Dr. Earl Stephenson, board-certified plastic surgeon and facial aesthetic expert. Real talk, real results, real transformations. Let's dive in.
Welcome to Plastic Surgery T&A. I am Dr. Earl Stephenson Jr., your Atlanta board certified plastic surgeon, here to spread truth and transformation. I'm dressed a little differently today. It's getting close to football season, so I've got my Oklahoma gear on. So from time to time, you may see me with various items of Oklahoma paraphernalia, but be that as it may, it's not quite football season yet, but I'm really getting in the spirit. So today I want to shift from football and let's talk about facelift surgery. We're going to talk about that facelift is not a one size fits all, especially when it comes to men and women. So we really want to break down the nuances and differences that your facelift expert should know, should have in his or her pocket so that they can give you the best results possible. So let's get into it. So, we're going to talk about diagnosis. We're going to talk about different techniques, plan, and really with a different game plan, you should have the same goal. We're going to talk about aftercare. We're going to talk a little bit about cultural pressures between men and women. And we're going to talk about finally, obviously, choosing the right facelift surgeon for you. So if you're interested and you got 20 minutes, hang with me. So, number one, diagnosis. Aging looks a bit different in men versus women. For women, typically, there's more volume loss in the cheeks and at times in the temples where you get this hollowing. You look a little bit skeletonized, which is the fancy $1 million word, but you get a little hollowing in your temples. You get a little loss of volume in your cheeks, a loss of plumpness. The skin gets a bit thinner and it has a bit more sag to it. Obviously, you have laxity of the lower jaw and neck, resulting in jaws. That's common for women, resulting in deep folds, which is common in women, but an overall gaunt look. So that's what women's aging looks like in general. For men, it's a bit different. Men's skin, facial tissues tend to be a bit heavier. So you're going to have jaws and skin wrinkles and bands of the neck and folds, but they look much, much more pronounced because the tissues are a ton heavier than in women. Thicker tissues, thicker skin, bulkier muscle leads to this. It gives a man a appearance of being less defined, not so much gaunt, but really less defined. If you really wanted to contrast, a woman looks more defined or almost skeletonized, and a man looks less defined. You can't really see the angles of his chin or jaw. So again, same goal, youthful or facial rejuvenation, but you have to appreciate what a man brings to the table versus what a woman brings to the table. My first job isn't really to recommend a procedure, it's to kind of read the face and how it's aged and read it from top to bottom, side to side, front to back and develop a roadmap for that particular man and a roadmap for that particular woman. And again, you can't rubber stamp it. So diagnosis is key, and that is from experience and training. So that's number one. Diagnosis and aging looks different between men and women. Number two, technique is a bit different. Game plan may be a bit different. The end goal is the same: refreshing facial rejuvenation. In women, the approach, We focus on accentuating or heightening the cheeks. We have softer curves. We kind of want a more natural lift. Incisions are concealed around the hairline and ear. And you can see in this uh, image that I have here, it gently cups the front hairline or short sideburn. It comes up right up to the top of the ear in front and really hugs the curves. Now, as you get to this little thing called the lobule, you've got two choices. In a woman, you can go behind or just at the edge of that, and that little specialized structure is called the tragus, and you can use what we call a retrotragal incision. And that further hides that incision, and then you can come back out on the front surface of the ear at a right angle, and then come and hug the earlobe, and then behind the ear in the crease, just to a point where the earlobe, if you push it against the skull, you make the transition into the hair, but not straight across, but down along and paralleling the hairline. So we want to make sure that our incision can certainly mimic that so that we can hide it. At this tragus, like I said, you can go retrotragal or you can just go in front of the tragus in a natural crease. If a woman has a very defined natural crease, I tend 9 times out of 10 to use that. This retrotragal incision sounds sexy, is theoretically sexy, sometimes produces, in my opinion, the facelift look because this structure is really unique. It's the cartilage is unique, and we don't want to damage it during surgery. The skin overlying that is definitely unique. It's really thin, it's really soft, it has really no hair. In men, it can have hair, but really no hair, and it really hugs the confines of that cartilage and really gives it anatomy. When you use that incision, that retrotragal incision, you pull or you advance the skin that you're gonna remove that skin and replace it basically with kind of cheek skin. You have to make sure in a woman that you can use their delicate skin of the cheek and really mimic and really hug those contours so it doesn't look blunted or odd. Because the natural reaction of the human eye is to go to something that doesn't look aesthetic. And if you have a blunted tragus, then that's going to be an eye catcher. So you want to really make sure as the surgeon that you understand if you're going to use that retrotragal incision, you need to really be spot on and reproducing the same anatomy, natural anatomy, so that this is not a stigmata of of a facelift. So the incision for women tends to follow that pattern. We combine lifting, and some people will combine filling and replacement of volume. Typically, fat grafting is something that I believe, and in my experience, occurs more commonly with women. Because again, remember, there's loss of volume, loss of softness, loss of curve. So you may use fat as a filler during the procedure to restore that volume, in addition to lifting and repositioning not only the skin, but the muscles to their more youthful position. So, again, different incision and volume replace it, as well as natural lifting, ends up in natural facial rejuvenation. For men, we must respect the beard line. You got to avoid pulling hair onto the ear. So most men have either some type of facial hair. It may be very prominent, obviously, or it may be very wispy. You've got to appreciate that. So, in regard to the incision, we still hug the sideburn. We come up, we come to the ear, We do not, and I repeat, we do not use the retrotragal incision because we do not want to move that facial or beard skin onto the hair. So that's a no no. We only got one choice of incision. We hug the deep crease in front of the ear. We still go around the earlobe and we go into the crease of the ear, just like in the woman. And we go and hug the hairline down toward the back of the neck. But we cannot pull beard hair onto the ear. So we need to pay more attention as a secondary focus to the lower face and neck. It tends to be heavier. There's more structures that require support. Uh, Surgery can be a little longer technically because of beard hair and facial hair. The men tend to bleed a little bit more. That's basically the bottom line. So it may take a little bit more time to slow bleeding, stop bleeding, make sure that the area is dry at the time before closing the incision so that we can avoid complications such as a collection of blood underneath the skin, which is called a hematoma. So it may be a little bit more technically challenging in a man because the man has better circulation due to facial hair. Facial hair requires more circulation for growth. So, different incision, you got to use that what we call a pre-auricular and not a retrotragal incision. We don't want to move beard hair onto the ear. We got to appreciate the heavier neck and more robust techniques to contour the neck. And we have to realize that it's a bit more robust in its circulation, so therefore it might be a little bit more time consuming to make sure that all bleeding is stopped just before the end of surgery. We still want to lift naturally. We don't want a volume replacement. Again, remember, men have bulky tissue, skin, and muscle, so we rarely have to volume replace, and that's different than women. So the end goal is a facial rejuvenation, both for men and women, but just different considerations as we reach or work toward that goal. You know, it's strategic. It is a physical lift, but it's a strategic lift. And you know, you gotta do everything subtly. So I would definitely make sure that when you choose your facelift surgeon, that they know how to approach men and women in that regard. Number three, aftercare. Healing ain't one size fits all either. For women, uh, they're more comfortable with makeup and scarves and covering for bruising with concealer. They're already used to kind of a skincare regimen in one form or fashion, which tends to help and aid aftercare healing. They're typically a little bit more flexible. I'm speaking in generalities now, as far as social downtime. So, those are some things to consider that actually benefit women in the recovery process. For men, you got to consider the shaving. Men will want to shave typically, and you got to kind of decide when is a good time to do that so that you don't one injure the skin that's been repositioned. You don't injure the incisions. For me, I can't give you a rubber stamp. We should do that at 7 days, at 10 days. A lot of surgeons will give you that. Maybe surgeons will even criticize me for not giving that. It really, again, is nuanced. I look at the health of my incisions, I look at the health of my skin, and I look at maybe a bit of the emotional distress that having facial hair that's uncontrolled that a man is dealing with, and I determine the right time. Typically, that's beyond 7 days. It might be closer to 10 to 14, but everybody's a little different. But you have to consider how shaving can affect aftercare, and you want to make sure that you time that appropriately for each male facelift. Men need basic skincare, so we're not used to doing that routinely or consistently. So we typically want to make sure that they start to implore some type of basic skincare. And for men, I try to keep it simple, and I try to keep it simple for women as well. If they don't have a regimen, we want some type of moisturizer for sure. at some point, and certainly not immediately after surgery or within the weeks of healing, we want to make sure we have some type of retinoic acid to help skin turnover and surveillance. We want to make sure that we always have some type of sunscreen to protect the skin health and protect our incisions at some point. So for men, we want to make sure we have them a good washing routine, uh, and make sure that they have use of good moisturizer and sunscreen and some type of retin-A component. That way, we can keep it pretty basic. If there's some particular nuances, like they have some uh, hyperpigmentation or some discoloration, we may consider some things to treat that, whether that's hydroquinone, kojic acid, uh, even some forms of vitamin C will help that. Again, we have to uh, not rubber stamp that. We have to look at our particular male patient's needs and try to come up with treatment solutions for that. But again, the overarching theme is men don't usually have a skincare regimen, and we need to start to implement that physically through repetition and through psychologically trying to get them to understand that this is part of their new normal and this is what they need to do, just like they need to brush their teeth and take a shower and shave. So we want to start to ingrain that. Men typically, in my opinion, require more privacy options. They're not really out there to kind of use a hat or some type of cover up, whether it's physical cover up with a garment or a clothing item to disguise swelling or bruising. So we got to kind of try to figure out how they can kind of stay a bit sequestered while they kind of get through the swelling and bruising phase. He doesn't want his barber to know. He doesn't want his fellow colleagues to know. He doesn't want the boardroom to know. So this is a real consideration and kind of getting the man so that he is somewhat sequestered and can heal and is comfortable with that time not being physically out front in most forms and fashion. So again, considerations for aftercare. Women are great with makeup and cover up, so we can use concealer. They're already tuned into to skincare, so which helps them in the post-operative or healing phase. They typically have more flexibility and are okay with a little bit social downtime and okay with even some social interaction with types of cover-ups that I mentioned. Men can be a little need to be a little bit more reclusive. They don't want this broadcast, so we have to consider that they need to be kind of sequestered for a greater period of time, both socially and professionally. We need to make sure that we understand that they're going to want to shave, especially have active facial hair and like to keep groom, and we need to time that appropriately for each man. And again, men just need to have a basic skincare that needs to be introduced psychologically and then just physically through repetition that will allow it to stick. So that's aftercare. Cultural pressures, and there are cultural pressures that are out there for men and women. In general, it's okay for women and socially permissible to have cosmetic surgery, to talk about cosmetic surgery, to want cosmetic surgery. It's no sweat. Women talk about that all the time to one another, to their male counterparts or partners or family members. Nobody bats an eye really. For men to really be concerned about that, to seek opinions about that, either in their peer groups or professional groups, or heaven forbid, visiting a plastic surgeon, that's a stigma. That somehow strikes down masculinity to some degree in certain circles, and so men are a little bit more hesitant to voice those concerns and seek solutions or potential remedies. And they don't want to look fake or feminine. So that's a real concern for a man. They don't want to look feminine typically. Males typically want a very strong or chiseled jawline. They want a cleaner neck. They want a tighter lower face. And they just want sharper, more angled features. So we definitely certainly want to tailor that to men where women definitely don't want sharper features. They want a more defined neck, but it has to be soft and subtle. It has to be feminine. And I think most plastic surgeons, because the preponderance of our clients that come and seek these treatments are women, and so we're comfortable with that. But when it comes to that, man that shows up or men that show up in our practices, they're not as prevalent having these procedures as women. So we really have to kind of re-engineer our thinking just a little bit and make sure that we don't feminize men and then add to the stigmata that men in the future who want this will just shut that down because they've seen examples where plastic surgeons, believe it or not, don't know the nuances between how to deliver a facelift for a man versus a woman. So again, cultural pressures are a real entity. Lastly, of course, with all that being said, we know the differences between men and women as far as what your surgeon should really think about in developing your plan to make sure that the right plan is selected, the right techniques are used, the right thought processes are used for recovery, so on and so forth. So, how do you choose the right surgeon for the job? Obviously, it goes without saying, you want someone to experience. You want to make sure that you understand their experience by speaking directly with them, talking about their previous cases, and they can show you some cases. You can talk about specifics, recovery, medications that are needed. And I will pause here because I didn't interject something that I think is very critical as far as medications. It may be more common for men to get an additional medication in their postoperative recovery. As I mentioned before, men have more robust circulation. Uh, in the immediate recovery phase, they may have some anxiety, some pain, which may drive up their blood pressure. And because they have more robust circulation, they may have more bleeding that occurs after surgery, which then can collect underneath the skin and cause a hematoma, which is a collection of blood, which looks terrible and unsightly, can be painful, but certainly can lead to infection and certainly can lead to disruption of the incisions and maybe, heaven forbid, death or necrosis of the skin. So, to kind of not even think about or mitigate or reduce the chances of that versus women, you know, typically I may provide or prescribe a blood pressure medication, especially if they're not on one, to lower blood pressure during at least the immediate recovery period because men have such robust circulation. So, again, we got to customize it. We definitely give pain medicine, antibiotic, anti nausea medicine for our both men and women. And I typically like to use arnica and bromelain as well. But in men, we may add a short course or duration of a blood pressure medicine. So you got to choose the right surgeon and you have those discussions to make sure that the surgeon knows how to take care of you. Uh, you want to make sure, obviously, at the end of the day, they can meet your aesthetic goals and they can talk to you whether your aesthetic goals are realistic. So, again, this is where science meets art. When it's done right, nobody will know, what happened. You'll look refreshed, you'll look renewed, you look like you had a long vacation, whatever. No one should know what work you've had. And that's the sign of good work. Basically, after all those things have been checked off, but preferably before those 2 things are checked off when you're in your consultation, you've sat down at your computer and you've gone to the American Board of Plastic Surgery. And here's the website for that right here on the screen. And you simply can look up your surgeon. I think really, having said all the things about how to choose a right surgeon, this is step number one. Find a surgeon in your area that you like or area of the country that you like and see if they're board certified. The next thing I would do is I would go to that state's local medical board, make sure there are no complaints about concerning the surgeon. And if they are, what are the complaints? Because sometimes complaints can be not founded or frivolous. So we want to make sure that they don't have complaints, hopefully, and if they do, that these complaints are not legitimate, you know, poor practice uh, complaints. So those two things are definitely paramount before you sit in someone's consultation room. And then you would do the usual things. I think you would go into their website and check out their work, check out their philosophy, check out their office, check out their staff, do some, sleuthing or vetting. And then if you want to go the next step, I think it's important. It's not mandatory, but I do think it's important that, they belong to at least the aesthetic society. And I don't mean as a slight, they can belong to the American Society of Plastic Surgeons or both, but they should belong to the aesthetic society for sure. So once you've done those things, you seek an in-person consultation and you talk to your surgeon about your expectations and you talk to them about their experience, as I mentioned before. So those are things that certainly should be done and can be done very readily. Don't be surprised if you have to pay for a consultation, especially for facial aesthetic surgery. Uh, so be prepared for that. On that note, I hope this brief podcast has been helpful. If you would like to work with me, whether you're in the Atlanta area or not, we take care of clients all over the country. It's very simple. You can do just a couple of things. Straightforward. You can call my office at 770-466-4700. We'll be happy to chat with you, answer any questions, and schedule your private consultation. You can also go to my website and you can contact us. There's the website address www.esjaesthetics.com and go to the contact me page once it's all said and done and just simply submit your information and my staff will call you and start that conversation and then schedule your consultation. We do virtual consultations to get the ball rolling as well. You can go to my website again and go to our virtual consultation page and follow that process. And we will set up your virtual consultation where you'll sit with me via video conferencing, and we will go through almost everything as if you were an in-person consultation, short of a direct physical examination, of course. But we offer that as well. All my consults, whether virtual or in person, are $225. And if you proceed forward and we are the right fit for you and you're the right fit for us, and we have a good plan, then that $225 comes off of your final surgery fee. Quote. All right. I think that does it for this podcast. Thanks for joining me. I always appreciate the channel is growing. Our subscribership is growing tremendously. So thank you, thank you, thank you. Again, as always, let's grow together just one click at a time. I appreciate your support. Please like and subscribe. And we'll continue to help the channel get more subscribers, which means the algorithm will say that we are somebody who should be looked at and put us in front of more people, which will allow me to bring you more information, get more sophisticated. Maybe I can one day get a video staff and I can show up and just do what I do and not have to wear all the hats. But, wishful thinking, we'll work towards that. But you watching and clicking can get me one step closer to providing you more information, more often, more impactful. So, with that, on that note, thank you for watching as always. Until next time, be happy, be healthy, and most of all, be kind.